Hi. Oops. Hi. So today I'm going to be presenting my intervention for my social problem that I did in topic 6. So my presentation title is called Addressing Housing Barriers for Formerly Incarcerated Individuals. So, identifying the community problem. So, the community problem is formerly incarcerated individuals having difficulty accessing stable housing. They experience a lot of discrimination due to their felony records. There's very limited reentry housing programs, not only within the United States, but also it's really bad here in New Mexico. There's also a high risk of homelessness and recidivism, and New Mexico has a high recidivism rate of 57%, which is way higher than the target due to many different barriers and one being able to secure stable housing. We have a huge homeless population here in Albuquerque, and a lot of those individuals are arrested a lot, and then rearrested and arrested, and kind of just like that catch and release. So yeah, that's kind of a huge issue right now. Um, so my proposed intervention is huge, and it's to develop a reentry housing support program here in New Mexico, Albuquerque specifically, or I think it's just New Mexico in general, but I want to develop a structured housing support program targeting just felony offenders, provision of transitional and having like those short-term options immediately after release, integration of case management services to support housing stability, coordination of services, including employment, mental health, and resource navigation, focus on long-term reintegration and reduction of recidivism. Sorry, I can't talk today. It's been a long day. So this program will be intended to help individuals secure stable housing and support reintegration. Obviously, a lot goes into just creating a program, right, to help individuals transition, reintegrate back into society. But I think it's important to have that support. And I think as social workers, and this is where like macro social work skills come into play, I think it's important for social workers to develop programs like these so that these individuals can feel supported, can have like so many services in one, right? And like have like refer to different programs in the community and create a team and collaboration to help these individuals feel supported because it's like a whole new world coming out of prison. Um, So, my program goals are to increase access to safe, stable, and affordable housing for formerly incarcerated individuals, reduce recidivism rates by addressing housing as a key social determinant, improve client stability, independence, and overall well being, utilize technology to enhance service, delivery, communication, and outcome tracking, promote long term reintegration through coordinated and continuous support. Program objectives. So this is really a huge portion of developing a program. So implement secure case management software like a database system to track client progress, service utilization, and outcomes. So I think this is important to create a database. Right now I am a full-time care coordinator. I work with children with mental health disorders um, at a huge hospital here in New Mexico, in Albuquerque at UNM Hospital, and we have a whole system of like electronic medical records of all of our clients. And after every service, we have to put in a note, which tracks progress over time. So I think creating a database similar to that would be very important, so that we're able to track our clients' progress from intake all the way until, they transition out of our program. We want to keep our program short term, um, so that, we're not keeping our clients long so that we can, keep accepting new clients because there are a lot of felony offenders in New Mexico. We have really high recidivism rates for those specific offenders. So I think it's important to kind of have a short-term program and then being able to kind of transition them out and then being able to bring in new clients. But I think being able to track their progress from the time they are at intake with us till they discharge is important because that helps us to understand our effectiveness as a program. Ensure ethical use of technology by maintaining client confidentiality, privacy, and data protection standards, HIPAA compliant, right? First of all, we want a database that is HIPAA compliant. We want it to be secure. We don't want anybody to be able to have access to it. So I think maybe bringing on like an IT team is probably very important to make sure all of our systems are working, and making sure that it's not easy to access, all of that client private information. I think that's important. But also, I know at the hospital, we have our own little communication system called Tiger Connect, where only all providers and employees throughout UNM Hospital can communicate through. So maybe creating like a communication software similar to that would be very, very important, just to make sure that when we are discussing, private information regarding our clients back and forth, um, it's protected and nobody else has access to it or nobody else can access to it. So that's also where like our IT team can come in as well. Obtain informed consent from clients regarding data collection, storage, and sharing practices. So I think at intake, having documents, going over documents with clients and letting them know about informed consent, the right to their privacy if they feel like their privacy is shared without their permission, like they can do all these things. But I think just having them sign and going through a legal packet and uploading like these signatures and these packets into our HIPAA compliant database is super important, just in case if anything comes back and bites us in the butt, we have that information like, no, they signed it, and we could release this information. Having like releases of information on file in their specific file online is, I think, is super efficient and super important to have. Establish protocols for secure communication and documentation within the program, which I kind of already went over. Develop ongoing monitoring systems, including audits and supervision to ensure ethical compliance and data integrity. We're going to go over that a little bit more in the next couple of slides, but audits are super important. I think monthly audits is important too, and also just like collaborating with our employees too, and them doing their own audits, and then also us doing our own audits, supervisors doing their own audits. I think it's important to have like an administrative team, and maybe like a team that can do audits if that's possible. But if not, I mean, we can do our own audits to make sure that we're in compliant with state standards and regulations, because I know that goes into a lot. So, my target population for this program includes formerly incarcerated individuals, especially those with felony convictions who are struggling to find stable housing. Many of these individuals are part of undeserved populations and may not have strong support systems like family and friends whenever they do get out of jail, which makes this program and this intervention super important. So key components and activities: housing, placement assistance, support, and secure, stable housing, case management services, focus on individualized care planning and goal setting, employment referrals and job readiness support services, coordination with community organizations, housing agencies, and support programs, ongoing client support, follow-up services, and resource navigation. I think it's important to have all these services in one program, to better assist these clients, to support them, trying to reintegrate back into society. So I think it's important. This is where like our macro social work skills will come into play with like building with community organizations, right? Like housing agencies, Albuquerque Housing Authority, Bernalillo County Housing Authority, Rio Rancho Housing Authority, and then also collaborating with other support programs like our Workforce Solutions here. They have programs that help formerly incarcerated individuals find jobs. So things like that. And I think that's important to do. And then just always having that ongoing client support, follow-up services, resource navigation, like what kind of resources are you needing? So this is where like assessments come into, where like comprehensive needs assessments, psychosocial assessments, social determinants assessments, things like that, to kind of understand like what do you need help with and how can we help you moving forward. It's not just going to be like housing, but it's also like other services to get them back into society and feel supported and feel like they can do it on their own. Resources. So our resources would include trained social workers, LCSWs, LMSWs, and then case managers too, because even if they don't, you know, have any type of social work degree, case managers, I think I would ensure like my case managers have um, a bachelor's degree at least in some type of human services field, to provide direct services and support, funding sources, including grants, right? Connecting with our government, possibly government funding, community partnerships. I don't know all that goes into that, but I know that's kind of like where a lot of funding comes from. Partnerships, housing, providers, landlords, reentry programs, kind of already talked about that. Technology resources such as case management software, data tracking systems, talked about that. Educational and supportive materials for clients and staff. Um, right. I think the biggest thing too about like coming out of prison is it's a whole new world, right? It's a whole new world to them, depending on how much time they've spent in prison. So I think the psychoeducation part is super important. A lot of these individuals may have not had a mother or a father to teach them, adult things and how to get a doctor and how to get a access to therapist and how to do these things. So I think the psychoeducation portion of a lot of things and just being able to have like supportive materials to provide that education to them is very important. Supervision. So I think like regular supervision meetings to support clinical decision making and ethical practice is important. We do that now within my current job. We have 2 meetings a month. So I think that's kind of what I would keep it to with like our whole team. Um, and then, ongoing consultation, like one-to-ones with supervisors, and then like individual supervision with your supervisor, team supervision, and then just making sure that we're following ethical standards, and those things, making sure that we have releases of information on file, making sure that we have our boundaries intact. We're not crossing boundaries. We're not um, friends with these individuals. We're not going on dates with them. We're not dating them, just to make sure that, everything is professional in this program. Training is important. I think these individuals have been through a lot of trauma in their life. So I think staff training on trauma-informed care is important. And then culture and competence, because we're going to be working with a lot of different individuals from different cultures, different backgrounds. So I think it's important to practice culture competence in this program. Support systems to prevent burnout and promote professional development. I think it's important to offer professional development. Moving up, in the program as an employee is important to like a supervisor, lead role, things like that. So I think that's important. So that would be something in my program that I would develop. And then, team bonding, we all have to be willing to work together and enjoy working together. So I think that's important. I have a supportive work environment at my current job, and I think that's important, just having that support. And, whether that's bringing coffee and we have coffee and we all sit and we all talk about our weekend, or we all talk about our day, or, we go out to lunch all together. Like, I think those things are super important. That's what builds relationships and trust. So my timeline, what that would look like, phase one would be like months 1 and 2. We do program planning, resource development, and partnership building, making sure that I have like all my social workers, all my employees pretty much. Phase two would be like months 3 and 4, program implementation and initial client enrollment. This is kind of like we're rolling out our program. I wouldn't take as many clients during this part just because we're trying to like roll out and just kind of see what the intake process looked like and like the whole process in general. Phase 3 would be like months 5 and 6, monitoring, evaluation, and program adjustments. In our textbook, Netting and all of the authors of the book, they really emphasize now in the chapters that we're reading, I think it's 11 and 12, emphasize like monitoring, evaluation, the different types of evaluation and the program adjustment. So I think it's important to take that information that I've learned and utilize that in this intervention, because I think ongoing monitoring, ongoing evaluation is important so we can understand if our program is effective, and if it's not effective, what areas can we change so that it is effective. And always just having that client feedback too is like, okay, whenever they're done with the program, we want to keep our program short, right? We don't want to keep it super, super long, because we want these individuals to go out and do things on their own and be independent, and but also feel supported. But at the end, when they are transitioning over into like, independency, I think it's important to like get their feedback. Like, hey, do you think this program worked out for you? Like, what do you think we did good? What do you think we can improve on? And um, just surveys and things like that, I think is important. Outcomes and evaluation, increase access to stable and secure housing for participants. We want to participate in the reduction of recidivism rates in New Mexico among our clients that we have in our program. We want to make sure that their well-being is improved. We want to make sure they have stability. We want to make sure that when we, push them off into the world, that they're independent and they can do it on their own and they're not going to go back to prison. Um, Evaluation through data tracking, client assessments, program outcomes, which I've discussed, and then just using both quantitative and qualitative data to measure effectiveness of the program. These are my resources, and that is it. Thank you so much. I really appreciate your time.